Hello friends, today we are going to deal with ventilators. The ventilators are the devices which is used to improve or help the patient to respirate. That is, it can be done either intermittently or throughout the process of breathing. It is being divided into two types: positive pressure ventilator or negative pressure ventilator. In positive pressure ventilator, the air is pushed into the lungs through the airway. Here, the inspiratory flow is generated by applying a positive pressure greater than the atmospheric pressure, and air is respirated passively. In the negative pressure ventilator, it is mainly used in weak and paralyzed patients. Here, the air is sucked into the lungs by a stimulating movement of the chest. That is, when the patient is really dependent, then the negative pressure ventilator is being used. Let's consider the three modes of operations. First is the assist mode, then the control mode, and the assist control mode. In assist mode, we can see that it works whenever a patient requires a help, then the assist mode is being used. That is, the patient is not completely dependent on the device, then we use the assist mode. That is, when the insufficient level of air is being seen, then the trigger is being given to the apparatus and the apparatus starts working, or it assists whenever the requirement is there. That process is known as assist mode. It does not function always. Next comes the control mode. This control mode ventilator is required for patients who are unable to breathe on their own. In this, the patient is totally dependent on the device and the respiration is completely done by or controlled by the device itself. That is, a timer is being set for inhalation time and exhalation time. That is the control mode. Next comes the assist control mode. As we have already explained, assist mode is the mode in which it just assists the patient. That is, whenever it is being required. This machine itself feels that if the patient is respiring by his own, then the assist mode is being used, and when the patient is not able to respirate by himself or herself, then the timer automatically triggers the device and it starts functioning. That process and that process continues until the patient recovers to its normal stage. Until that stage, the control mode is being continued. So this is the assist control mode. Both the assist mode and the control mode is being used here. Now let's see the diagram. In this diagram, we can see that the patient is being given an inspiratory flow is being delivered to the system, and an exhalation control system is being also connected to the system. This is being controlled by a device, and this is the block diagram of a ventilator. Thank you.